everyone. I'm really excited that we, with the help of everyone here, that we're all here today to talk about such an important topic, and certainly in the 8 months that I've been in this role, has been a major priority. So thank you all for being with us today. I'm honored here today to highlight our collaborative work to advance maternal child health in Maryland. Thank you to Michelle Stewart and Maxine Reed-Vance with Baltimore Healthy Start for your leadership and dedication to providing birthing Marylanders and their families with the health care and resources they need and deserve. And certainly thank you for hosting this great event. Thank you, Secretary Becerra, Administrator Johnson, Dr. Go from the Office of the Vice President for joining us here today in Baltimore City and for your partnership in helping us to advance maternal health and child health. We are so appreciative of the U.S. Department of Health and Human Services and the Health Resources Service Administration for awarding the Maryland Department of Health $800,000 to enhance the quality of care, safety, and equity people receive immediately, during and immediately after birth. We will use the funding to support the ongoing work of the Maryland Perinatal Neonatal Quality Collaborative to implement the Alliance for Innovation on Maternal Health Patient Safety Bundles in 32 birthing hospitals in Maryland. This effort will improve maternal and infant health and eliminate preventable deaths and severe illnesses. We're also partnering with Baltimore-based Bloom Collective to provide training, capacity building, and technical assistance to the Maryland Perinatal Neonatal Quality Collaborative to address racial disparities in maternal morbidity and mortality. Over the next 4 years of the grant period, the Maryland Department of Health commits to making births safer, improving maternal health care quality, and saving the lives of birthing people across the state. I'm also thrilled today to be joined by Mayor Scott, Mayor of Baltimore City. We are so grateful for your leadership on maternal and child health in Baltimore, and we are excited for the work that resulted as a result of this grant award to improve maternal and child health outcomes in Baltimore City. After Mayor Scott, we will hear from our federal partners, Administrative of Health Resources and Service Administration, Carole Johnson, Secretary of Health and Human Services, Secretary Becerra, and Dr. Ying Go, who joins us again, as I mentioned, from the Office of the Vice President, Carol Harris. So thank you all again for coming today, and I will turn it over to you, Mayor Scott.
Thank you, Secretary Scott. No relation. Good morning, everyone. And it's so exciting for me to be here, for us to be discussing the needs of something that we know is extremely important. So excited to be able to all of our federal and state partners. Thank you, Madam Secretary, for doing the easy job of acknowledging almost everyone. It makes my job a little easier. Of course, Secretary, we're glad to have you back in Baltimore. It's been a few months, but as I said before, you're looking for an additional home. We have here, but also want to recognize my Deputy Mayor, Health Commissioner, Deputy Mayor Dr. Terraza, who's been leading in this work for a long time, and my State Delegate Kayla Young, who has joined us today. But I think that we know how serious this issue is, and for me, recently it became very personal. I'm about to be a dad for the first time and understand the very real issues that women, particularly women of color, face when it comes to maternal health, right? And having seen my mom, but also my younger cousins and folks go through it and know what that really means about how we value them and treat them and make sure they have access to all the things they need to make sure they're not only the baby, but that they are as healthy as possible. So I am so thankful for our partners for recognizing the critical need in our communities here in Baltimore, for supporting us and recognizing all the incredible work in places across Baltimore, like here at Healthy Start, that is happening. With federal investment, that so many of these maternal and child health care advocacy programs like Healthy Start and its parent program, Be More Healthy for Babies, were able to make a deep impact. We all know, Mr. Secretary, over the years, these programs have saved the lives of 400 babies in the city of Baltimore, decreased teen birth rates and the racial disparity in teen birth rates by 60%, also decreasing infant mortality by 24%, and decreased the black and white disparity in outcomes for children. Provided training to 5,000 world-class professionals. That is what the investment has been able to do. I am thankful for that, for those resources, but more importantly, thankful for the organizations on the ground here in Baltimore that do that work, the ones that build the relationships with the community, build the relationships with those families, and provide those services for people who we know need it, and more importantly, who deserve it, so that they and their family can thrive. So thank you very much for having me here today.
Thank you very much, Mayor. Next, I'd like to turn it over to Administrator Johnson.
Thank you so much, Dr. Scott. I don't know if you can hear, or can you hear in the back? Okay. It's really my pleasure to be here today. I'm Carole Johnson. I'm the Administrator of the Health Resources and Services Administration. Thank you, Mr. Mayor, for your leadership, for making women's health a priority in Baltimore. It is such a pleasure for me to be around this table and to be here with Lachelle Stewart, who leads Baltimore Healthy Start. Can we have a round of applause? Every day, this organization is saving lives, and this is how healthcare should be delivered. This is what women need. Women don't need a complicated process to go figure out how to get a provider and wait a long time and then not know and understand the complicated directions that they're given. They need community health workers. They need neighborhood partners. They need safe spaces to be able to get healthcare delivery. And so that's why we're so excited at the Health Resources and Services Administration to support Healthy Start and to grow Healthy Start. And so today we're really fortunate because of the leadership of the Vice President, and particularly because of the leadership of Secretary Becerra, who's told all of us across HHS, this is our priority. We need to double down and find all available policy and resources to support women's health. And that's what we're doing. So today, across the nation, we at HRSA are awarding $90 million to support women's health. And $8.7 million of those resources will come here to Maryland. And just to say a little bit about that, $3.3 million will be focused on access to maternal health care services. That's about investing in the state, creating the innovation tables that Dr. Scott talked about, which means putting everyone together and designing strategies that work for Maryland communities. In some communities, that might mean doing mobile vans to get into places where people don't have access. In other places, it might mean building green spaces where people have access to healthy environments. There's so much work to do, and we can't do that unless we put not just the government folks, but the community folks around a table together to be able to craft those solutions. We're also investing in what we call integrated maternal health services, but this is really about having a pregnancy medical home. How do we make sure that women in underserved communities get that kind of support and get the critical resources they need? So there's a touch base, there's a place to know how to get that kind of support. We're also investing in families. That's what Healthy Start does here in Baltimore. We're going to expand Healthy Start in Hyattsville, in Silver Spring, and learn from what you have done here. As Lachelle said, and as I always say, HRSA grantees, like Healthy Start, have been doing social determinants of health before it had a name. That is what this work is, and we're going to expand on what you've done elsewhere across Maryland. And then I'm really excited to announce that we worked with Congress to secure new resources to invest in minority-serving institutions to do the critical research, to show what works, and to build the best practices going forward. It is, and this is something the Secretary says all the time, research was built on white men. I'm sorry, I'm putting words in his mouth. I'm saying that. Research was built on white men. And we need to be able to do the research in communities where we're doing this work. And so we are delighted to announce that Morgan State will be our coordinating center. We're going to fund a research network in universities across the country, but Morgan State is going to be the coordinating center and drive this work so that we know we can take what works and expand it and get it to communities across the country. So we are thrilled to be here. I want to in particular thank Gladys. It is so important to have patients' voices, to have moms' voices at this table. I want to thank all the leaders at this table. This work only happens because you take the time to apply, and no applying is something that we're constantly working on making it easier to do. But we are so proud to be partners with you, and we are going to save lives thanks to your efforts. And so now it's my real pleasure to introduce Secretary Becerra, who leads the Department of Health and Human Services at the federal level and is constantly an advocate for the communities that we at HRSA serve, making sure that historically underserved communities and rural communities get the healthcare support they need. Mr. Secretary.
Administrator Johnson, thank you very much. Secretary Scott, thank you for taking the time to be here. I know this is important to you because if we can get it right here, that means that the entire state of Maryland is gonna do much better. And when Morgan State gets out there and starts this ball rolling, it's gonna be helpful for everyone throughout the country. So I think this is a great to be able to come together, but thank you for taking the time to be here. To Dr. Go, thank you so much for the work that you and of course Vice President Harris are doing on this issue. I know that this one's a big one for the Vice President, that she really wants to take a lead in making sure that we're addressing these issues of women's health. And fortunately, the Administrator knows that at HRSA we have an opportunity to really make a difference. And all these investments, if they're done right, and for me, done right means getting to the people who've had the lived experience so that we can actually make the quality out of that dollar really come out. I want to thank Carole for all the work that she's doing. Mayor, every time we get together, it's something good.
It's good. That's why you gotta come every day.
We were together not long ago to deal with some behavioral health issues, especially for young people. And gathering now together for this particular issue, maternal health. I thank you for making this one of the important stops for you, because I know as mayor, there are any number of things you should be doing today in Baltimore, but it's important that people see that you're here today. I want to say to Director Stewart and to Dr. Reed-Vance, thanks for everything you're doing, for showing what we should have been doing a long time ago and just continue to do it right. It's really odd, isn't it? From the moment our babies are born, we start to teach them, look both ways before you cross the street, buckle up. We do everything we can to save their lives so they thrive when they're older. Somehow we forget though, when they're older, to continue that. Don't miss your checkup. Go in for your baby. Why should we stop all of a sudden? We can save lives just as easily by having a woman come in for a prenatal checkup as we can by teaching her, but she's a child, to look both ways before she crosses the street. But somehow we let it go. We're saying, no, we're not gonna let it go, because we know we can save a life. Just as we could save a life if your child buckles up in that car, we know we could save a life if a woman knows she should come in for that checkup before she delivers that baby. And now, because President Biden and Vice President Harris made this commitment to make those types of opportunities available longer, we can tell a woman, if she's had a baby, you know what? Come in for your care postpartum on day 1, on day 30, on day 60. Used to be in Medicaid, if you went in on day 60, that was it. Medicaid would no longer cover your visits postpartum. Not anymore. Under this administration, a woman is now able to get care for 365 days after she delivers her baby. And Maryland and so we're thrilled. But I have to end by saying I'd be punished if I didn't come. Not because I didn't learn to look both ways. My wife was a perinatologist at high-risk OB/GYN at one point in California, in the LA area. She ran our Best Babies program in Southern California, which was our 1 to 5 program, but it was for the pre-1-year-old, because everyone started saying, wait, we're starting at 1 through 5. What happens before they turn 1? And as a high-risk OB/GYN, she was asked to help run that program. And so her work was about what we're talking about right now, is making sure not just the baby has a healthy start at 1, but at birth. And for her, it wasn't just at birth, because once the baby delivers, the OB stops. It's now the pediatrician, right? So she said, we're going to start way before birth. We're going to start when the mother's contemplating having that baby, and start them there to make sure that baby will be healthy. So I'm here because for the longest time my wife was devoted to this, and she is thrilled to see the Department of Health and Human Services just take this on. So to each and every one of us who are having this opportunity, we're gonna live both ways, but we're crossing that street, and we're gonna make a difference for a lot of people, so I'm thrilled to be here. And I know, we're now gonna hear from Dr. Ghost, Secretary Scott, are you gonna introduce her?
No, you just did it.
Well,
Now
let me
put it
just,
on the-
let me just say to Dr. Go, thank you, because I know that this is a priority at the White House. It's been clear, every step that we take on this, the White House is with us, and it's got the fingerprints of Vice President Harris written all over it. So, Dr. Go, thrilled to have you with us.
And I'm so pleased to be here to celebrate these important actions that we're announcing, but also just to be in this community and meet you all. As you know, Vice President Harris has really called this country to action on this issue. And as a senator, she introduced the Omnibus Act of 2020. As Vice President in 2021, she launched a call to action for public and private partnership to take action to address maternal health. And then last year, she announced the White House plan blueprint for addressing the maternal health crisis, which was a directive to our agencies to identify deliberate and tangible plans to really improve maternal health outcomes. So this is building on her record of fighting for the health, safety, and wellness for women and children for a long time in her career. And I'm here to just to restate what the Secretary has stated, which is that the Biden-Harris administration is steadfast in its commitment to improving maternal health for all women in our country. And I really thank everyone for being here, and I look forward to the discussion and hopefully hearing some of your stories and personal experiences. Thank you.
Thank you for sharing that. And I do want to add, the blueprint is the basis for the women's health strategy that the state of Maryland now has. And not only does it address some of the topics we'll be hearing more about today, but it's focused on equity and behavioral health. And, I feel very fortunate to have the team that I have here. Our Deputy Secretary of Public Health is here, our Deputy Secretary of Behavioral Health is here, our Women's Health Director, and our Health Promotion Administrator Director, all here today, just to, emphasize the commitment that the state is bringing to this matter. So thank you for your leadership, all of you, and certainly for creating the path that we are now on to do a better job to address maternal health and the health of our babies in Maryland. So with that, I'm going to jump in, and we are fortunate today to be joined by recipients of the maternal health grant programs in Baltimore and surrounding areas. We know about the importance of these programs. If you've already said, they are the member-facing, patient-facing programs that make the difference day in and day out. They're the ones providing care for women and their babies, and we are so grateful not only for the work you do every day, but to be joined by our federal and local partners that make this all happen. Because without the grants that you provide to us, we couldn't then work with our community partners to deliver the services to the women and families that need it most. So I'd like to start off a discussion today to hear from one of our participants, Gladys Qualls, who is a participant in Healthy Start. So we are so grateful that you joined us today, and we're hoping to hear a little bit about your experience in accessing services through Healthy Start.
So good morning, everybody. A little background information. I was first introduced to Baltimore Healthy Start through a friend of mine. They had the baby buggy walk last year, and I was pregnant at the time, so she was like, come on, let's go. Nevertheless, went and kind of just was exposed to like the resources, the opportunity, the help. I always call it the village, the support that, I was looking for, and I know that, many other moms are looking for. So I registered, reached out to me, started the program, and kind of from there I could kind of say, like I always say, life was up from there. Baltimore Healthy Start has like kind of done like a lot for me, like from little things like they have this new housing university program. As a young mom of two, not being able to properly go through my nesting stage because I didn't have a place to nest. Baltimore Healthy Start kind of picked me up. They sent me through their housing university program, taught me how to be a proper tenant, how to read leases, how to understand contracts. Like they, gave me the tools needed to succeed in life. So that way, my second go around with my second baby, which is now enrolled in the program, I was able to, know how to look for housing, how to, be a good tenant, how to, properly, just do things, like even like teaching me credit, so that way one day I can be a homeowner, because don't nobody ever want to rent for life, but until Baltimore Healthy Start came into my life, I didn't know that, I had the option right now to start the process of, owning a home, or what it takes really to own a home. Little things like resources, like, therapy, different mom groups. We had a convention back in, I want to say it was like May, where they had took me to Chicago, and it was like one of the most eye-opening things for me, because reflecting on what you guys are doing, I teared up a little bit, because the fact that now postpartum visits covers 365 days, it's like, that means something to me, because it's like, for the healthcare system to tell me that a mom can go through postpartum anytime from 2 months, 3 months to 12 months of pregnancy, but to tell me postpartum care stops 2 months afterwards, and then I'm stuck to figure out really what to do on my own those last 9-10 months of possibly needing that postpartum care, it really like warmed my heart. So it's like, I appreciate what you guys are doing and giving to us, and then like, having resources like Baltimore Healthy Start just to help me through my journey of motherhood when it comes to like needing resources like Pampers, teaching me. And like I was telling her earlier, me and the father of my child were not together, so it's like when we separated, educating him, like the fact that they focus on families, the fact that I was able to, bring the father of my child into the program so that they can teach him things like safe sleep. Like when you have my kids, that was my biggest thing as a new mom. It's like, okay, I have to share my kid with this dude. And he doesn't even know to, don't leave blankets or teddy bears or things like that, that consciously he's not thinking of around the baby, to avoid things like SIDS and, take away, thank you so much, infant mortality rate. So I appreciate Baltimore Healthy Start for things like that, because it made, the journey of motherhood less easy, not having to stress on, okay, teaching the father of my child how to be a father. They were able to guide him through that, along with also helping me get the resources that I needed to be a better mom and a stronger mom, and realizing that I have a village and a community behind me to support me. So thank you, Baltimore Healthy Start. Thank you guys. Because I didn't even know that you guys did that, but it really hit me, because it's like, literally, like you said, 30, 60 days postpartum done. And then with me, I was type 1 diabetic, so I was still dealing with gestational diabetes, and it's like, that just threw me out, and was kind of like, and then I had a newborn baby, so it's like, how am I supposed to postpartumly focus on my health as a single mom, and postpartum care stops? It's like, after I had the baby, they stopped caring about the mom. And that's kind of what I want to change in mother health care. Like, what are we here for? Like, yeah. Sorry, but thank you guys.
So thank you for sharing your story. And, this is a perfect example to your point about why the programs like Healthy Start are just so important, because it sounds like it's had an impact on your life, and the impact of other lives of women that are not here to share the story you just shared. So
When I didn't have postpartum, I had Baltimore Healthy Start.
Thank you. So we've heard about some of the challenges around maternal health around the table, and the new award mentioned by Administrator Johnson regarding the MSI Coordinating and Research Center, which will support 16 research award recipients, which will focus on applied research to understand what's going on in maternal mortality and severe maternal morbidity. We just don't know what we don't know, and certainly some of the studies that have come out have not focused on the entire population, or the population primarily impacted today. And so we are so excited as we think about the maternal health outcomes that we want to learn from finding community-based solutions to advance maternal health equity, that institutions like Morgan State will be receiving this important award. So Dr. Baptiste Roberts, please share with us why Morgan State University, an historically Black college and university, decided to take on this work, and what we will be doing with the grant.
So first of all, thank you for inviting me, and good morning, everyone. And I want to acknowledge Dr. Yvonne Bronner, who's not here with us today. She is the PI of this to think about, well, what is it that's going on and how can we help? There's been a lot of investment in maternal child health, but of course, the needle has moved, but not to the extent that we wanted to move. The disparities still exist. We have the Black maternal health mortality crisis. So what do we need to do? What's the problem? We see a lack of diversity within the MCH workforce. We see a lack of diversity with respect to research funding. And so Dr. Bronner convened, and myself convened a group going to the Consortium of African American Public Health Programs. This is a consortium of accredited public health programs at the HBCUs. And we asked, who's interested in trying to get MCH academic programming into your universities? 10 people responded. And then Dr. Bronner, since she's been in the field forever, she was able to connect with her partners and use her existing relationships. And we started talking with folks at HRSA and MCHD. And we have had an amazing partnership with HRSA. They've been extremely supportive of what we wanted to do and the impact that we want to make in maternal child health across the country, not just in Maryland. Often our students are from communities that are underserved, and they want to serve the communities that they come from. And so we believe in having healthy communities, producing healthy people, not having healthy people in unhealthy communities. Another factor that we considered was that often a lot of the research funding goes to larger institutions who then reach out to the HBCUs because they have an excellent reputation with the community. And what they do is they ask us to assist with outreach. And our faculty are not growing, they're not publishing, they're not able to get tenure. They're not able then to apply for research grants as well, because they're just on this, they just have a little piece of the pie. And so what this research grant allows us to do is to build research capacity, research infrastructure, and design research projects that are community engaged and strategic, culturally tailored, and hopefully we can see that needle move.
Make your own pie, right? That's what we're doing.
And I want to say, so we have flagged this, what you described in our own granting process, and we're looking at that now to change that dynamic. So hopefully you'll see some changes, not just from the federal government, but your own state government as well.
And just to add one more thing, this group, it's called HAT, HBCU Alliance Team for Maternal Child Health, and some of the people in the room serve on our advisory council. What we were able to do is, and what Dr. Bronner has done, is that in this coordinating center grant, we all will work together, even schools who did not apply because they didn't have the capacity to apply, they will be included. So this, we're gonna have an impact across the country. And thank you again to HRSA for collaborating with us, for receiving our recommendations. And this has been an amazing journey because the schools have collaborated, leveraging our strengths, helping each other with the grant proposals, and Morgan State University, the Center for Urban Health Equity that's funded by the state of Maryland. We supported grant writer and the efforts for this collaborative. So thank you.
So next, we've already heard one, incredible example of how Healthy Start is such an important program and makes such a difference to address the needs of new moms. Maxine Reed-Vance has been a leader here at Baltimore Healthy Start for, Maxine, we were hoping to hear from you or share more about the work that's happening here and the impact it's making.
Thank you guys, and thank everybody for coming. I would just be remiss if I didn't introduce Deborah Frazier, who is the CEO of the National Healthy Start Association and gives us so much support. And our board chair, Regina Webb, she is too. Because, the philosophy here is that health is in the community. We all live in community. Health is in the community. And so, because we believe that, our focus is on community. We have, we're in 38 census tracts in the city of Baltimore. We see approximately 1,000 women through our doors in a year, as a matter of fact. We are holistic. We have recruiters who go out into these neighborhoods and they knock on doors. And they're looking for pregnant women, they're looking for postpartum women, they're looking for babies who are 18 months or less, and they enroll them into Healthy Start. And we have a lengthy enrollment process because we want to find out all that we need to know so that we can build this care plan that the client agrees to and signs, as a matter of fact, so that we can provide the care and services that is needed. Home visiting is one of the strategies that we use. We have center-based activities, and one of our center-based activities is called Belly Buddies. And Belly Buddies is a stress reduction program that we trademarked. In Belly Buddies, mom gets yoga, prenatal yoga. We have scrapbooking and knitting because we found that knitting actually reduces stress. And some folk, I drop stitches, so it doesn't work for me. We have nutrition and child development in that space. And with the food, and this is one thing, we have a food demonstration. And so then after that demonstration, we actually give the food, everything that we use, to the mothers so they can go home and prepare for their families. And that's our way of tuning them into nutritious food. I'm a life course advocate, and like the Secretary said, we need to start really, really young. So I've been advocating, and Rebecca Deneen, as the Maternal Child Health Commissioner in the city, knows that that's my soapbox that I talk about that all the time, that we have health centers in schools. Pregnancy is just this little piece of the maturational process for a woman. And so if we start checking blood pressures, and if we start making sure that children have those physical exams in first grade, not only because they're playing soccer or football or basketball, but every child, so that we can have a healthy population who is healthy when they become pregnant. And so that's my push, that we do that in schools. We have a captive audience. We can do that. We test for scoliosis and we get immunizations. We can check for blood pressure and waist-hip ratios and all of those things, because we can do that. You guys, we have the ability and the capability to do that. And we work at Healthy Start in innovation. When there was this increase in sexually transmitted diseases in Baltimore, we said, okay, we can do PCR with urine. And so we collected urine from our clients and sent it to Hopkins for them to tell us whether our clients had chlamydia or gonorrhea. We tested for bacterial vaginosis when it was thought to cause preterm labor. We can do those things in community. And we use evidence-based tools in order to do that. And before the administration extended the 12-month period, we got a maternal health supplement from HRSA, and we used those funds to do dyad care in the federally qualified health center. So that meant that a mother, when she brought her baby for well baby checkups, she could also have a checkup. And that started at 2 weeks, 4 weeks, 4 months, 6 months, and 12 months. Then she was handed to the primary care physician, and we made sure that she had a primary care physician. And that is in one of our largest federally qualified health centers, Total Health Care. And now starting on the 3rd of October, we will be in Chase Braxton with Diet Care. Because we know that moms will take their babies for their checkups, but they don't take care of themselves as they do their babies. So we do that. And our housing university, housing is a really big deal. And so with, as Gladys talked about, we have this huge plan to take care of moms and place them in housing and get landlords to designate so many units for pregnant and postpartum women. They've agreed to do that. We have the Housing University courses for landlords and for tenants. And we just had this huge landlord symposium on the 16th of September, and it was magnificent. Everybody is talking about it. So landlords are aware of tenants' rights, and the tenants are aware of what landlords expect. It's just so much that we do, and we do it with love, and we do it with compassion, and it is a joy for us here at Healthy Start to work in community. And all of the folk who work with us, all of our community health workers, and we call them neighborhood health advocates because they come from the neighborhoods that we serve. And that's important because Baltimore is a neighborhood city.
Amen.
And so it's a neighborhood city. So you need to know, if you're on the east side, that the stuff that's on the east side may not work on the west side. So we have folk who work here and have been here for a long time and do great work in community. And it is our pleasure, and there's so much more I could talk about, but I think that the Secretary probably has something else he wants to do today. So, and Dr. Karenga, as one of our partners, and received, can I say that, Dr. Karenga? Sure. Received Maternal Health grant and works with us because another one of our passions is severe maternal morbidity. And we are working with our jurisdictional MMR team so that we can start presenting severe maternal morbidity so we can get some recommendations out to the state in reference to how we can mitigate those things before they end up causing death.
So thank you. You said a lot there, right? One, we appreciate just to focus on mom. Gladys, just to hear your story. But I liken it, to the airplane model, right? You put your oxygen mask on yourself and then on your child, and we can't do that if we're not taking the right care for our moms to be able to do that, not only for themselves, for their families. And then on the MMR information, we know that women of color are entering pregnancy sicker than they've ever entered before, and we're not sure why. So any lessons learned from that MMR process? We're looking at claims, but claims don't tell the story that you know, boots on the ground, just from the women you serve and from the information that you're getting from that process. So we're really looking forward to that, and certainly anything that you learn through the research. We're a sponge right now, trying to take it all in and figure out where do we put the resources to have the most impact on the women and families that need it most. So thank you for that.
One other thing, we were just thinking, we've been doing social determinants of health for a long time. And it came to my attention that perhaps it should be a diagnostic code in ICD. Just food for thought.
So there are codes, it's reimbursement for those codes.
Yes,
That's the issue right now.
reimbursement. That's the point that I wanted to get, reimbursement for, for that.
We'll take that back to CMS.
How should I answer that? Thank you. So next, we wanted to share a little bit more about the Maryland Health Department's program, the Alliance for Innovation on Maternal Health, or the AIM program, that helps to improve maternal health outcomes within clinical or integrated maternal health services programs. So with these funds, we partner with the Baltimore-based Bloom Collective, and to ensure Black birthing people are centered in the collaborative quality improvement work. So today, Lynn Harris is here today from the Bloom Collective, and today, anything that you would like to share about the work you're doing in the partnership with the Health Department?
Sure. Thank you so much for having us to be a part of this roundtable discussion. I'll first speak about the grant, and then I'll speak about Bloom specifically. The part for the grant is really to work with the 32 birthing hospitals to really center reproductive justice which is a framework, which are principles and their values. That the term and the intentions of it was coined by 12 Black women in 1994. That was really not just about the right to have children, the right to not have children, to also have those children in sustainable, holistic communities. It's about creating the container for the right conditions to make that make manifest. So that means everything is a reproductive justice issue. If people cannot make their best decisions, if there are things that are hindering them for them to be able to do that. So we really want to work with the birthing hospitals across the state to be able to start thinking about this. How do we really infuse intentionality? How do we really infuse love? And we've been seeing that through the Hopkins clinics, through folks at University of Maryland and throughout the state, who are really excited about the ongoing works of this, individuals within the hospitals and within the clinic. So we're really excited about leaning into that. The Bloom Collective, we are centered right on Greenmount Avenue, right off of 20th and Greenmount, right off of North Ave. And so we are known as the Bloom Collective, but we are also, if you look us up, we're Bloom in Baltimore. We do also have an office in Howard County, but we are dedicated to Baltimore Mayor. So we really try to honor and center. We know, and what has, since our inception of 2018, we have also been together prior to 2018, but we knew we wanted to come together. We wanted to work together. We wanted to lean into one another. So we provide childbirth education, perinatal mental health, lactation, and postpartum doula services. We are just one arm of that, and we know that it requires a whole contingent of that work. We don't want to leave moms by the wayside. We are also one of the kindred partners with the Black Mamas Matter Alliance. We've been a kindred partner since 2016. And so a lot of our alliance partners were with VP Kamala Harris, and she was Senator Kamala Harris, and sitting around that table. And so right here in Baltimore, we just want to continue to be that anchor of support. It being seemingly underfunded in the work that we have done has allowed us to lean into the beauty of Baltimore, to really look at the ecosystem that's around us in our community, to find other perinatal mental health therapists, to find other lactation specialists, to find people who are doing housing, to find people who are doing yoga. And so it's been a beautiful opportunity for us to really love, and we also know that there are still gaps. And so we are excited about what's to come, what we know is going to happen. And we also do ask that you remember those of us, those little small organizations who are situated in their community, who are doing the work, who are following on the legacy of the grand midwives. My great-great-grandmother was a grand midwife in Seneca, South Carolina. So when we think about evidence-based, it's the people who've been doing this for the people. So we're following that legacy, and we're just trying to continue to be an anchor of support in our own community that we love, Charm City, because we always want everyone to bloom in Baltimore.
Thank you for that. Love that. I wrote down a few things you say. Infuse intentionality in the beauty of Baltimore. So thank you for those words. And next, I'd like to go to Dr. Linnea Richardson, who is involved in the maternal mental health care. And we know, again, back to the number of women with, mental health diagnosis, behavioral health diagnosis, including substance use disorder, going into pregnancy, to share about the importance of the programs like the one Administrator Johnson and Secretary Becerra mentioned. Can you please share some of your on-the-ground experiences in the work that you do?
Sure. And I just have to say, I'm taking this all in. I feel so honored to be here and to hear, Gladys share. She would be a person that I would see, right, on the mental health side. So when you talked about the postpartum side of it and trying to navigate what is it like to be a mom, to be a new mom. I'm also a mother, which is a part of how I got into this space. So when you shared that Bloom Collective started in 2018, I had my daughter in 2018 and had my own experience of childbirth trauma. And that is what started my work in focusing specifically on maternal mental health, because I recognized that that wasn't a thing. I didn't go to, when I went to school, I never took a class about what happens when women have children and they're dealing with mental health. What happens when women have children and they don't have resources. So I've been doing this work since 2018, specifically focusing and honing in on maternal mental health. And as a Black woman myself, and we've shared this as women of color, we know the mortality rate where women are 3 times more likely to die in childbirth. So when I hear that and I think about that statistic, anytime a woman like myself goes into the hospital to have a baby, there is a chance that she won't make it out. And I see those women who do make it out, but they're experiencing the residual of that. And so for me, as a mental health, from the mental health perspective, I'm hearing it from the health side, and I'm thinking about, sometimes we forget the interconnectedness of our physical health and our mental health. And so if you're not healthy physically, then mentally you will suffer. If you're not healthy mentally, then physically you will suffer. You talked about putting your mask on first. That's one of my favorite lines to get to my clients. You have to take care of yourself. How can we be healthy and take care of our kids and our children if we aren't doing well? And a lot of my mothers, so from the groundwork, a lot of the women that I work with talk about feeling invisible, right? They're taken well care of when they're pregnant. They go to prenatal checkups. They are constantly being poked and prodded. I've been in those situations. And then after you have the baby, that's it. And when you're pregnant, people have a seat, sit down, and they will do so much for you. And when you have a baby, you're trying to push a stroller and open a door, right? So we don't even think about mothers as having a significant place as much as we think about the children. So it's almost like this, I'm forgotten once I have the baby, and this will weigh on individuals' mental health. And so what I try to do is support them in recognizing their value, their importance, sharing the Bloom Collective. I participated as an individual before I even knew that this was the path and journey that I was going to be on. As I was listening, the other thing that came up for me was recognizing the importance of education, because that is what you all have shared here today, is that what we're doing is trying to get the information out there to provide education and information about these circumstances, these situations, and what can we do about it. As I was sharing earlier, I am a person who comes in as an intervener. I come to provide intervention, but we are talking about prevention. And so I would rather be on the side of helping moms are coming to me to just talk about adjusting to motherhood, which is what most people want to experience. Like, I have children now, my life has changed. Not, I have children now, my life has changed, and here are these other things that have happened because of the healthcare the health services that I did not receive, or the things that didn't happen for me, or in ways in which I wasn't supported. And I know we all want to move away from the pandemic, but as a mental health professional, I would be remiss if I didn't say that we are still coming out of this very traumatic world experience where all of us have been impacted mentally and emotionally. And so when we're talking about adjustment, like why are people suffering, what's going on, there's this lingering experience that I think we all are still adjusting to. So when you add children in the mix, when you add pregnancy, when you add mental health, then you'll see that it complicates the way that we experience the world. So, for me, I would love to be in a space where these prevention these things are in place, that women are healthy, and that they're coming to me to get the support, the other part of that village that we talk about, not because they're trying to deal with trauma, take care of a child, and save their lives. So that is my focus as well, is really how do we save the lives of these women, in particular when it comes to the reasons that they are dying are preventable. And so if I have nothing else to share, that is what I feel like I'm here for, to be a voice for the women who are experiencing this. Again, just having Gladys to share her story, I feel connected to that as a woman myself who is also a mother. And I think that's the piece that we forget, that many of us in this room are also mothers, and we can go back and think about our own experiences.
Thank you for sharing. Thank you. Little fit earrings, by the way. Just
Yeah,
notice what's on them.
exactly.
Just notice what's on them.
That's
So.
the message.
Yes, exactly. Thank you. And Mayor Scott, I want to thank you for joining us today for your commitment to maternal child health, and wanted to ask you your thoughts on what you would like to share on the importance of this work in Baltimore.
Well, I think I shared a little bit about it earlier with the reductions that we've had, but I think the most important thing I'm going to say is what you hear this common theme, right, about how even though we've come so far, we have much longer to go, especially when we're understanding how this really impacts Black and brown women in Baltimore, but around this country, right? And we know when you hear about not being looked at the doctor the same way, we all know why that is, right? And we have to really own that and dig deep into that. We're talking about systems that were built around racism, that still have racism embedded in them. And it's gonna be up to us that now, and cease to impact that, and impact a way to remove that, right? Going through, right? Working with the people on the ground that know best of how to build that system. So for me, it's really about how we all gonna remain committed to doing that and acknowledging and calling that out, right? And we know, for many of us, the secretary, the vice president, the president, myself included, when we call out of those kind of historic injustices that we know were designed that way on purpose, it is going to come with some backlash for us. But that backlash is worth it if we're saving not just the lives of babies, but women who are caring for those babies, who are taking care of their families, who are providing for their families in every way, and really understanding how we can modernize something through a lens of equity, through the understanding of our history, but also how we can really do the best to put that system moving forward. I think that's the most important thing. We know it works. We know it works. We just have to invest in it, build in it, and make that the norm and not the exception, at no matter the cost. If that means that we have to tear down the existing system, so be it. We have to do that and do it knowing that it might come at a cost for some people like me. Right? Maybe I'm no longer elected if we do that, but that's fine. If that system is put in place that saves lives for years and years to come.
So couldn't agree more, and it all, starts with, representation at our levels, and I think certainly the Moore Miller administration has been committed to diversifying the cabinet, so we have people that look like and sound like the people that we represent, so, I hope certainly my role in my small way will make the difference, but, the state as a whole is committed to exactly what you said, and really redefining what healthcare should look like for citizens. Thank you for those comments. So I'd like to open it up to discussion to anyone else around the table that may have any closing comments.
So I'd love to just chime in because Gladys, I hope that what you come out of this with is knowing that this is deeper than what you see in terms of how many people are actually behind the effort to try to reach women and their babies early. And because when it goes as deep as the state, the city, and of course the federal government, the folks who actually do it on the ground, it really takes, as I say, the village to make it happen. And so, but I don't think we've seen this intensity of commitment at all levels of government ever. But then again, if you saw 2 or 3 times the number of kids dying as they cross the street, or 2 or 3 number of kids dying in a car accident, you ask the question, what's going on? Well, that's exactly what's happening. Right now, we have women who are dying at 2 or 3 times the rate than other communities. We should be asking, what's going on? And that's what this is about. It's asking what's going on. And so here, what we're trying to do at HHS is we're not just trying to fund those maternal health programs, but we're trying to look at Medicaid differently. That healthcare dollar that Medicaid used to provide 10 years ago is not the Medicaid dollar that we're providing. Today, we want to help a woman find housing with a Medicaid dollar. Today, we want a woman to be able to go to a grocery store to buy, fresh foods at a reasonable price with that Medicaid dollar. Because today, Medicaid believes that Medicaid isn't just about having you go to the hospital to get well. No, it's about keeping you well so you never have to go to the hospital. And at the end of the day, we're saving taxpayers money. Right. And so right now, we have states, and Maryland has one of the more advanced health systems in the country, where you make sure that you have an all-payer system in your hospital system where everybody can go. But states today are innovative. So my state of California, today, they have a waiver for Medicaid to actually use their Medicaid dollars for more than just hospitals and doctors. If they could show us that by helping fund housing insecurity issues and nutrition issues, they're keeping someone healthier, they're gonna let you use that Medicaid dollar, which is supposed to be a health dollar, to go and have access to those bus tokens you need so you can get to your prenatal care visit. And while a bus token doesn't look like health care, for many folks in too many communities, that is the best healthcare that they can get. In fact, I think it was Director Stewart, what's the name of it? You have a nurse who does the outreach, is it Archie?
Maryland?
Yes.
Virgie, is it? Yeah,
Maryland, Virgie.
she was saying is that one of the things she finds is when she goes into homes and talks to some of these women, they're missing their appointments because they didn't have access to the transportation. And so, healthcare is giving you access to your doctor. And so, we're gonna be willing to invest in, Gladys, you being able to connect to your doctor, not just your pediatrician, but your OB or your family doctor. And whatever it takes, we want you to do it because we know you'll still stay healthy. We're actually now trying to get schools to become healthcare providers, so they can qualify directly for a Medicaid dollar. That way they don't have to beg or use their money for education to keep kids healthy. And so if we can put a Medicaid dollar into the school and therefore provide healthcare at the school, by the way, it's not gonna just help the kid, it's gonna help all the family as well. And so we wanna look at it differently. And so for us, healthcare now is not about, as I say, we should not have a system that's built on caring for illness. We should have a system that's promoting wellness. And so a healthcare dollar is wisely invested if we help you, Gladys, access the people that will keep you healthy. And that means we're saving taxpayers a ton of money. And so I hope what we will take from this is you all have to continue to just push. And then when Dr. Baptiste Roberts gets all those people together now, uses the best data that they've collected in communities where they need it, we're gonna know where to put those dollars and how to put them. Because at the end of the day, I probably save taxpayers more money by giving you a bus token than if I just try to figure out how I can graduate the next physician who you may never access. So we're in this and we want in.
I just
So
want to add
whatever
one
you're
thing
doing,
with
go.
Secretary finished. Gladys, make sure you see me so we can get you in the home ownership class.
Well, I want to thank you all for joining us here today. Secretary Becerra and all, Administrator Johnson and Dr. Go, we know how busy your schedules are, so thank you for making the trip to Baltimore, and everyone here in this room and your commitment to maternal child health. We certainly, as several of you have said, it takes a village, and only with, us partnering together will we make a difference. And we look forward to the continued partnership with federal, state, and local partners, and as Secretary Becerra has mentioned, we are aligned in a way that we haven't been in years. And so, we certainly think of it as a huge opportunity in the state of Maryland to really make a difference. So thank you all. And with that, Secretary Becerra, Administrator Johnson, any further closing remarks?
No. There's one in.
Well, thank you everyone for being here today. Thank you.
Thanks.